Good afternoon, everybody, and thank you so much for taking time out of your Friday afternoon to join us today. My name is Dr. Stephanie Vanderpool, and I am Assistant Professor of Anesthesiology at the University of Tennessee School of Medicine, and also the Director of Comprehensive Pain Services at the University of Tennessee Medical Center. We would like to welcome you to today's webinar on targeted pain treatment and how it can help you and your loved ones improve your quality of life. We're going to start off by sharing the slide presentation, and I want to make sure that everybody can see it. A couple of housekeeping items. There is a live chat in the webinar or the portal. If you are having any questions, it's called live Q&A. Feel free to drop a question in there. If you want to go ahead and type that you can see my slides, go ahead and do that in the live Q&A. And we will go ahead and get started. All right. So I want you to take a moment and imagine 20 years of living in pain, a stabbing pain that shoots from the middle of your stomach all the way through to your back. It balls you up, you can't move, you're not able to work. You are basically just struggling to get through the day. You're suffering. You try to seek help from the medical community. You go to different doctors, you go to different healthcare facilities, and nobody can figure out what's going on with you. They can't seem to help you with this pain that you're suffering from. You're not able to work because of this pain, and the people who love you watch you suffer and are worried about you. You've tried pain clinics, but all they seem to want to do is give you pain medication. You don't like how it makes you feel, and you don't want to keep taking them because you're worried about addiction. You've tried procedures and they really haven't worked either. So what is there to do? I want to give you some hope today because this story I described is a true story. This is a story of a patient of mine, Deb Satterfield, who was gracious enough to share her story with us. You may have seen her on WVLT News this week, sharing her story about how targeted pain treatment has changed her life. And you actually have an opportunity after today's session to view her story and her husband sharing it with us on the portal after today's session. But what changed her life and allowed her to enjoy life again was targeted pain treatment. So why are we here today? We're here today to equip and empower persons with pain to find relief and improve their quality of life through targeted pain treatment. We're here for three main reasons. We want to give you hope. We want to let you know that there's a different way of dealing with pain. We want to tell you how to do it. And we're going to talk about how targeted pain treatment is different and how it can help change your quality of life and give you the life you're looking for. And then we're going to talk to you about how you can help yourself or your loved ones get access to targeted pain treatment and start living life free from pain. So first off, let's start about hope. Targeted pain treatment provides hope for patients living with chronic pain. So we've got an audience question coming up. Now this is going to populate in your session. I want you to look for it. It's an audience poll. And here's the question. If you or a loved one are living in pain, what are your options? The question is live. Go ahead and take a minute or so to answer. And I'm going to look at the answers as they come in. The poll should be up on the actual audience response. So I've got some physical therapy coming in. I'm going to read the options and you can just pick the one that makes the most sense or that you've heard of before. So just live with it. Take pills, but worry about side effects and addiction. Just do less because it hurts to do too much. Physical therapy, injections, don't know. Or is there something else that you think or that you deal with for pain? So let me look at what we've got. So we've got, the poll results are still coming in. We've got physical therapies in the lead with 36%. And then we've got pills and do less with 14%, they're tied, and other. So we're kind of, physical therapy, okay, we've got just do less. So a lot of folks have kind of given up on being able to do what they want to do because of pain, or they'll go to physical therapy and hope that that helps them improve their function. Well, I want to let you know that you don't have to suffer with pain. You can have pain anywhere in your body and there's a science behind what causes pain, and there's also a science behind how to treat it. And that's what we're going to talk about today. But first, we need to understand why traditional pain management may not have worked for you. We have to treat the target for pain because pain is actually a symptom of an underlying condition. And by treating the target, what that means is we have to get to the actual source of pain. So too often, untargeted treatments or ineffective treatments cause ineffective relief, which then leads to dose escalation, tolerance, dependence, and addiction. And that can be the case with pain medications, which is why so many people are now afraid of them. You can't go past the news without figuring out that opioid addiction and an opioid crisis is gripping our country, and so many people are suffering from it. But there's a reason why opioids haven't worked as well as we'd want them to in order to help patients improve their quality of life. And that's because when we treat pain without treating a clear target, it's kind of like putting a Band-Aid over some sort of very fastly bleeding wound. You've got a Band-Aid over it, but you haven't stopped the underlying bleeding. So then you need to put a bigger Band-Aid on, and then a bigger one, and a bigger one. And eventually you end up just soaking through all the bandages because the bleeding hasn't stopped. That's what it's like when we try to treat pain without actually treating the underlying cause. So the targeted pain treatment approach is different. We accurately diagnose the cause of pain. That is the first step in targeted pain treatment, and then target the treatment to that identified cause. And what that does is it gives us a solution for chronic pain because we're able to reduce opioid use, effectively treat pain, and improve function and quality of life. So with targeted pain treatment, you can get back to living and enjoying life again. You can go and do your exercises on the beach. You can take a stroll or play with your grandkids. You can take that bike ride in the mountains that you haven't been able to do for so long. Why? Because we're treating the underlying cause of your pain and helping you get to that level of function that you want to be able to achieve. So remember, we had 3 things we were covering today: hope, how, and help. So for summary, for hope, you don't have to suffer with pain. Traditional pain management may not have worked for you in the past because they may not have been treating the actual underlying cause instead of just treating the symptom or the pain score. And then targeted pain treatment approach is different because we accurately diagnose the cause of pain and then target the treatment to the cause. So that was hope. Now let's go to how. How targeted pain treatment provides relief of your pain and improves your function. So there are 3 core principles with targeted pain treatment. The first is that we want to accurately diagnose all the causes of your chronic pain. The second is that we want to treat the source and not the score. And the third is that we want to focus on function. So when it comes to accurately diagnosing the cause of pain, this is an analogy that I like to use. I use a car. So if you think about a car, it's got 4 tires. And if you have 4 tires on a car and one of them gets flat and you put air in one tire, you can probably get along pretty good. But what if you had 2 flat tires or 3 flat tires or even 4 flat tires? Well, the thing with pain is that there can be many different causes or types of pain. And in terms of the types of pain, you've got 4 main types. Your physiologic cause of pain, which is how the body processes the pain signals. Your anatomic cause of pain, which is how structures such as muscles, bones, joints, and nerves can contribute to the pain that you're experiencing. Your functional causes of pain, such as injury, posture, movement, or other position-related factors. And then psychosocial causes of pain, which is how the mind deals with emotions, stresses, or environmental factors. So when it comes to figuring out the causes of your pain, we want to take a 3-step approach. The first is we want to listen to your story. How did the pain start? What was going on when it occurred? Were you doing something out of the ordinary? Was there a fall, a trauma, something that caused you to start experiencing this pain? Next, very important, we want to do a physical exam. Now, a physical exam is not just looking at you and talking to you. A physical exam is actually touching the patient, laying hands on where the patient is hurting, because that gives us so much information about the muscles, the nerves, the different body parts that might be contributing to your pain. And then third, we want to review your tests. Notice I don't start with your imaging. I don't start with what your MRI shows. I start with your story. And that's important because your story gives us the framework within which we can put all the other pieces of the puzzle together. So what do we learn about your pain from these three components? Well, your story actually gives us the most information. It can tell us about all the flat tires, the physiologic causes of pain, the functional causes, the anatomic causes, and the psychosocial causes. Your exam will often tell us a lot of information about your anatomic causes of pain, the bones, joints, muscles, and some of the functional causes. Are you having to change the way you walk because of pain? Are you sitting differently? Can you not move your neck very much because of the pain? And then your tests will often clue us into some of the anatomic causes, and in some cases, such as diabetes and hemoglobin A1C, some of the physiologic components that could be contributing to your pain. So, how many flat tires do you have? So next, go to targeted pain treatment principle number 2. Treat the source, not the score. How do we target treatments to the cause? Well, just like we were talking about flat tires, we're going to talk about air pumps now, but there are unique air pumps for each flat tire. We refer to them in targeted pain treatment as M.I.P.S, medications, interventions, physical therapy, and psychosocial therapy. Medications target the physiologic cause of pain, the way that pain signal is transmitted in the body. Interventions target the anatomic structures that cause the pain. Physical therapy targets the functional limitations caused by the pain, and psychosocial therapy targets the psychosocial comorbidity associated with the pain. So now it's time for a second audience question. This is the second poll that's going to go live. Which of the following comments about pain treatment have you heard or said before? Now be honest, because I know you've heard or said some of these, probably more than once. Number 1, medications are addictive. Number 2, injections don't work. Number 3, physical therapy makes pain worse. Number 4, psychosocial treatment is a waste of time. Some of the above or all of the above? Let's look at the poll and see where we are. Oh, I've got it. All of the above is in the lead. Medications are addictive. We hear a lot about that, especially with the opioid crisis. And then I've heard a lot of physical therapy makes pain worse. We've got 6% on the poll right now, but I've definitely heard that before. As a pain specialist, a targeted pain treatment specialist, I've heard all of these before. You will not hurt my feelings, okay? But we're going to kind of debunk some of these with the next few slides. The main keys with targeted pain treatment and treating the source of your pain is that you want to be specific, strategic, and safe. Now we're going to go through each of those 4 ways of treating pain: medications, interventions, physical therapy, psychosocial, and we're going to apply the specific, strategic, safe to that to help you understand how targeted pain treatment might be different from what you've experienced before. So first, let's start with medications. Remember, medications treat the physiologic cause of your pain. So there are many types of medications out there, but what we want to know is you want to know what type of pain we're treating, and then pick a medication that targets the way that pain is being transmitted. So for example, anti-inflammatory medications such as ibuprofen, which everybody's familiar with, those treat inflammatory types of pain. Muscle relaxers will treat muscle spasm. Nerve pain medications such as gabapentin will treat nerve pain or that burning, tingling pain. Topical medications, these are medications that you rub onto your skin or apply with a patch. Those can often give you relief of superficial, peripheral pain. And then antidepressants work on centralized pain. But remember, opioids do not target the source of pain. Opioids just cover up the way your body perceives pain. So it's important to realize that while opioids absolutely have an important role in treating predominantly acute pain, for example, post-surgical pain after you've had an operation, they are not really a core tenet of treating long-term pain because they don't treat the source. Remember that Band-Aid analogy. So we want to be specific, strategic, and safe when selecting our medications. We want to be specific in that we want to target the type of pain that you're experiencing. We want to be strategic because there are some medications that have side effects that may or may not be appropriate for you. For example, some muscle relaxers may make you feel very sleepy. Well, if you're actually having trouble sleeping at night because of pain, maybe taking a muscle relaxer in the evening might help in both ways. And then we want to absolutely be safe. People who have had gastric bypass surgery, for example, can't take anti-inflammatories. We need to know that about your history. If you're taking a blood thinner, we want to make sure that we don't give you an increased risk of having a stomach bleed. things of that nature. So we always want to consider all of those factors. Next, we're going to talk about interventions. So there are three main types of interventions that we can offer. Diagnostic interventions are really test injections. They really only last a few hours, and they're designed to help us figure out if we've correctly identified the anatomic source of your pain, which nerve or which muscle or which joint is actually the source of your pain. Therapeutic injections often involve steroid, and those can last from weeks to months. And that again is determined on putting it in the right location. And then there are many, many advanced therapies that we offer. Ablations, which is burning of nerves, implanted devices that send electrical stimulation to your spinal cord and reset the pain signals, and other treatments, all of which can last from months to years. Again, we want to be specific, strategic, and safe with these interventions. Specific meaning we want to get right on top of that anatomic target. Strategic meaning if you've got multiple anatomic targets, say you've got really bad buttock pain and you've also got really bad back pain, but your buttock pain is so bad that you cannot sit down to do anything, you can't do your job, you can't think, you can't sleep. Well, I can help with your back pain, but if that buttock pain is still there, it's not going to matter what I did to your back because you still can't sit. So we want to be strategic and make sure we're addressing the pain that's limiting your function the most. And then we want to obviously be safe. We use image guidance, state-of-the-art ultrasound, fluoroscopy, which is X-ray, and any other type of technique to allow us to make sure we're putting this intervention or this injection exactly where it needs to go, so that we can be safe for you. The other thing we have to consider is what medications you're on. Many patients are taking blood thinners on a regular basis, and we have to be mindful of the timing so that we don't inadvertently or accidentally cause any type of problem because you're taking a blood thinner while you get an injection. So we coordinate all of that between you and your primary care clinician or your cardiologist to make sure that we can safely do injections for you. Third, we've got physical therapy. So there are many types of physical therapy out there. I just listed a few, but physical therapy is an integral part of targeted pain treatment. It has to be done in order to help you improve your function. That said, we need to identify what our goals are. Are we trying to work on your balance? Are you falling a lot because you can't stand up? Are we working on your walking? Are you so weak that you can't really walk through a few steps? What about strength? Do you feel like your legs aren't holding you, or maybe you're dropping things because your arms are weak? What about your neck range of motion? Can you turn your head to drive? Is that now limited because the pain is stopping you from being able to turn your head? Or what about your back range of motion, bending, lifting, and so on? Again, specific, strategic, and safe. Doing physical therapy while your pain is in 10 out of 10 state or flared up is really not going to be as effective as when we first treat the cause of pain and then send you to physical therapy. Why? Because you're able to better participate in the therapy while you're doing it because you're not hurting as badly. So it's not that physical therapy necessarily makes pain worse. It's about putting the timing of physical therapy in the right order with the other treatments that we're doing. Next, we've got psychosocial treatment. So types of psychosocial treatment, again, just a few or just a sampling: counseling, meditation, biofeedback, and many, many other forms of psychosocial treatment. One thing I'd like to highlight that we offer here at the University of Tennessee Medical Center is an integrative medicine consultation. My colleague, Dr. Clayton Bell and Dr. Rocio Hewitt are excellent integrative medicine clinicians who really are able to meld or combine evidence-based modern medicine and long-established healing traditions to get a patient-centered approach to deliver holistic and wellness-oriented mind, body, spirit therapeutic encounters. But that means that they work with what's bothering you the most on all components, whether it be your sleep, your nutrition, your movement, anxiety. All of these components are available at the Integrative Health Center, and we really, really value working with our colleagues over there because of the good that they do for so many of our patients. So that brings us to targeted pain treatment principle number 3, focus on function. I want you to think about this for a second. What is your pain stopping you from doing? Is there something you used to be able to do that you can't do or can't enjoy because of your pain? What do you want to start doing again? Is it gardening? Is it walking your dog? Is it playing with your grandkids? What is limiting your function the most? Is it your back, your leg, your neck? What is causing you to not be able to function the way you want to function? Basically, what we want to do is make or help our patients get from flat tires to moving again. And that's what we do with targeted pain treatment. So in summary, principle number one, we want to accurately diagnose the cause of pain, and we want to identify which of those tires are flat. Remember, you can have multiple causes of pain: physiologic, anatomic, functional, psychosocial. You can even have multiple causes of pain in the same location at the same time. Once we've identified the cause of pain accurately, then we want to target the treatment to the cause. That's what we use the acronym M.I.P.S: medications, interventions, physical therapy, psychosocial. And we want to be specific, strategic, and safe in everything that we do for pain treatment. And next, we want to have a focus on function. What is pain limiting you from doing? And make a plan to improve your function so you can start enjoying life again. I want to take a moment and share a story with you. This is a story of a patient of mine, Mr. Sefton. And I want you to just hear in his words how he started and where he is today through the benefit of targeted pain treatment. Take a listen. The first time that we met each other, 2018. And I remember very clearly you came in with 2 hiking sticks to walk with. Do you remember that? Tell me about that.
Well, as I said, I couldn't get out of bed in the morning. I mean, the pain getting into bed, swinging one's legs over to get into bed or swinging them out to get out, it was horrendous. And just walking to the bathroom, I had to have 2 sticks. So, and I think the statement that I always remember from not only your team, but also my other doctor's team was, I don't understand how you managed to walk in here. And that really summed it up, because I was barely walking at that time.
Your MRI was impressive, I will tell you that. We looked at those MRI pictures and we went over all of them, and myself and our team looked at it, and we were just trying to figure out where to start. What was causing you the worst discomfort?
I think what you've managed to do is target all the different things. I mean, it's not just one thing in my back. I mean, you're the specialist, but I would say that there are a number of areas that would cause different pain. And I think you've managed to target each one of those, not necessarily all at the same time, but gradually over a period of time, whilst you've always professed that you're relieving the pain or targeting the source of the pain. It appears to me that as time goes on, inflammation goes down and remains down. And then when I come back, I've got another twinge somewhere and you'll target that. And so gradually, I don't believe that, whilst you profess it's not a cure, I wouldn't be as I am today after 2.5 years and walking around without pain if you hadn't had long-lasting effect on me.
Now, I want you to listen in to how he describes his function after targeted pain treatment. Take a listen. Well, I certainly am so glad that you've had the positive outcomes you've had. I mean, it really is a testament to identifying the underlying cause of pain and knowing that multiple factors can be contributing to your pain at the same time or at different times in terms of your ability to be able to do things. So just to remind everybody who's watching, you started off coming to see me walking on 2 canes to get from the bed to the bathroom. And I think you just told me when you went to Chicago this weekend to visit your granddaughter, your daughter, how many flights of stairs did you have to walk?
She lives on a 2nd floor apartment right in the center of Chicago. And I had 4 flights of stairs to walk up. We had to carry the bags up, et cetera. Also had to I took our 2 dogs with us. So every time they wanted to go out, we had to go down 2 flights of stairs. And then she has a garage at the bottom, but that was 6 flights of stairs. So every time we went out and we were going to go in the car, there was 6 flights. But more importantly, there was 6 flights back up again. And, I managed those actually. I mean, you'd think from my age, I'd be out of breath and all that. But I mean, it didn't affect me at all.
was around the first. So I first want to thank Mr. Sefton for taking the time to share his story on how targeted pain treatment has helped him and helped him improve his function. But second, I want to let you know how you can help yourself or others that you love get access to targeted pain treatment. So this is our third poll question. How do you currently advocate for yourself or your loved one with pain? Do you just live with it, don't do anything about it? Do you look things up on the internet? What about going with them to appointments, pre-COVID mostly? Writing down your questions for the doctor or clinician? Asking for explanations about treatment options, or maybe something else? The poll is open. Let's see what we got. All right, we've got some, I don't do anything, that's in the lead. We do have some folks who write down their questions for the doctor and clinician. That's great. Asking for explanations. So a little bit of everything. Great. Well, I want to introduce you to the ABCDs of pain advocacy. I want you to remember these 4 components when it comes to trying to advocate for yourself or your loved ones. The first is to ask questions. What's causing my pain? What can we do about it? Ask them to be specific to describe what's going on with you and what is the source of your pain. Next, you want to be optimistic. Be open to treatment options. There may be treatment options recommended that you may have tried before or tried some version of before, but your physicians, especially your targeted pain treatment specialists, may be prescribing it in a different order. Remember that specific strategic safe component? So we want to make sure that you're optimistic and open to these treatment options, especially if there's a strategy or a rationale behind or a reason behind why it's being done. But you want to clarify the plan. So that's your C. Clarify the plan. Why are we doing it? Why are we going through this particular treatment option in this particular strategy? How is it going to help me with my pain? And then finally, you need to do your part. Focus on function. Get up and walk if you can. If not, let's figure out what's stopping you from walking so that you can continue to improve your function step by step. So we're here to help you. At the University Center for Pain Management, which is a division of university anesthesiologists, we have an amazing team. These are just our clinicians, but our team could not do what we did without all of our medical assistants, front desk staff, collectors, everybody that is a part of this organization. But I want to just give you a heads up or introduction to the 4 clinicians that you would meet if you come to see us at University Center for Pain Management here at UT Medical Center. Myself, Dr. Stephanie Vanderpool, I'm the medical director. My colleague, Dr. Jonathan McBride, is also board certified in both anesthesiology and pain medicine. And he is another pain medicine targeted pain treatment specialist here at the University Center for Pain Management. And we have our 2 amazing nurse practitioners, Audrey Wall and George Mears. They both help us be able to serve our patients by helping us get to that accurate diagnosis and prescribing the treatment options that Dr. McBride and myself are able to carry out. So make sure that you, wherever you're going, that you have a team that works together to be able to help you with the underlying cause of your pain and make sure they're treating the source and not the score. I have some resources for you. These are some websites and online resources. The first is UT Medical Center's website. That's utmedicalcenter.org. You can go there to find a physician if you don't already have a primary care physician, or to get referrals to other specialists, neurosurgery or so on in the location, wherever you are, if you're in East Tennessee. Now, our website for the University Center for Pain Management is ucpmk.com, University Center for Pain Management of Knoxville, ucpmk.com. And then we also have a targeted pain treatment YouTube channel where you can learn little snippets about targeted pain treatment or share them or subscribe to get more information on how targeted pain treatment can help you or your loved ones with pain. For your clinicians, because you may be going to a clinician that may not be familiar with targeted pain treatment, we have a website at the Graduate School of Medicine, which you can get to at www.tpt-toolkit.com. And it has several tools and resources to help clinicians be able to practice targeted pain treatment. And I also want to encourage them to save the date for our 4th annual Targeted Pain Treatment Conference. It's going to be February 25th, 2022. And we'll have more information available on that tpt-toolkit.com website. But what can you do today? If you have pain or a loved one of yours has pain that's limiting their function, their enjoyment, their quality of life, I want to encourage you to schedule an appointment with your clinician. Call them, schedule an appointment, and talk to them about how pain is limiting your function and quality of life. Request a referral to a pain specialist, or request a referral to physical therapy or some other treatment that can allow you to start treating the underlying cause of your pain. If your clinician is not familiar with targeted pain treatment, encourage them to check out the website www.tpt-toolkit.com for tools and resources that will help them get started with targeted pain treatment. And then finally, subscribe to the Targeted Pain Treatment YouTube channel, because you can always learn more about targeted pain treatment, and this is a patient-focused channel that gives you that information. Remember, targeted pain treatment provides hope for patients living with chronic pain. How targeted pain treatment provides relief of your pain and improves your function is by accurately diagnosing that underlying cause of pain and targeting the treatment to the cause. And then finally, you can help yourself or your loved one get access to targeted pain treatment by using the resources and steps described above. I thank you for your time. And now we're going to open up to any questions you may have. You may put your questions in the chat, and I will invite Audrey to turn her camera on now, and we're going to start moderating and answering some of these questions you may have. Thank you so much. Hi, Audrey.
Hi. Let's look at our questions. Let's see our live Q&A. Don't know that we have. Oh, first question. How can I get a family member into your office?
Very good question. Well, you can request a referral to UCPMK, and you can go on our website, ucpmk.com, where there's a new patient page, and request a referral. We take patients by physician referral, and that's because we want to be able to communicate with your clinician and make sure we have an understanding of everything that's going on with you, so that we can prescribe the treatment options that are safest in light of everything else that you have going on. But ucpmk.com is where you can go to find out more about referring a physician to referring a family member or yourself to our practice.
We have another question from Tracy. Do you take VA patients?
Absolutely. Same process. You can ask to request that the VA make a referral to UCPMK, and we will be able to get them evaluated. We have several VA patients. We love taking care of our vets. They've served our country, and we love to help them be able to maintain and improve their function. We have a few favorites. We're not going to call, HIPAA can't call any names, but we do love them.
All right.
So there may be some other questions you might have about, say, injections. So I have had so many patients tell me that they are deathly afraid of injections. They do not want injections. And I want to encourage you all to know that there are options for your injections. We provide injection services at 2 locations here at UCPMK. At the office, or in our office, we have a state-of-the-art fluoroscopy suite where we provide fluoro or X-ray guided injections. We also have ultrasound that we do ultrasound guided injections in the office. But in addition to that, we also provide these services at the UT day surgery, outpatient day surgery, where depending on your insurance, there may be options for sedation, oral sedation, or so on to help with the anxiety. So I don't want you to worry so much about your fear of needles that it prevents you from potentially getting access to life-changing improvements in your function.
We have another statement from Jay. He actually has a Medtronic spinal cord stimulator, and he finds it totally acceptable for his pain.
That is wonderful, Jay. I'm glad that you're getting good relief from a Medtronic spinal cord stimulator. There are several types of spinal cord stimulators that are available, and we implant just about all of them here at University Center for Pain Management. And let's talk a little bit about spinal cord stimulation. So spinal cord stimulation is one of those advanced treatment options I mentioned in our interventions section of targeted pain treatment. And what that does is it sends an electrical signal to the spinal cord that changes the way your body perceives the pain signals that are normally causing you chronic pain. And the process for spinal cord stimulation is a 2-step process. The first is once we've identified that you're an appropriate candidate, we will do what's called a test procedure, where we put in some temporary wires in your back. what that allows us to do is see if the spinal cord stimulation device makes a life-changing difference for you. We really want to see, does it help you improve your function? I have had patients with spinal cord stimulation or during trials who have had to use the rollator at Walmart, the motorized scooter. During the stimulation trial, they're able to walk all the way around Walmart without any assistive devices. That's how much of a difference it can make for patients living with chronic pain. So absolutely, spinal cord stimulation is a very good option for treating certain types of chronic pain, and we do offer that here at UCPMK.
We have a good question from Aaron. The first appointment in our office, how long would it be, or how long should you expect it to take? What should a patient expect during that first appointment?
So in the very first appointment, we are very, very thorough. We go over your entire history, your physical exam, like I described in that accurate diagnosis section of the talk. And then we go over your treatment options and take our time to educate you and make sure you understand all of the treatment options that are there. I would say coming into our office, we ask that you arrive about an hour ahead of time to complete all of the paperwork, and then allow for at least an hour to 90 minutes, sometimes up to 2 hours for the entire process to take place. And that's so that we can go through all of those different steps. The other thing that I want to highlight that's a bit unique about UCPMK is that you will always have an attending physician, myself or Dr. McBride, or some of the other attending physicians from the Department of Anesthesiology, available for our nurse practitioners. So we always have a double layer of support and knowledge to make sure that we're getting you the most accurate diagnosis and the best information possible. Audrey, can you speak to your experience as a nurse practitioner here and kind of what it's like to work in the team model that I described?
Absolutely. So I actually have worked in 2 pain practices, this and another prior to this. Our office is completely different than I think most pain practices in that we have physicians here almost 100% of the time. And our nurse practitioners consult with our physicians multiple times a day on multiple patients. It is very common for patients when they're in our office, even for just a follow-up visit, to see both the nurse practitioner and the physician. Physicians step in and take time out of their day to lay hands on the patient if the nurse practitioner isn't 100% sure which direction we should go. And it's a totally different experience than what most patients have had at other clinics, regardless of specialists, regardless if it's pain management or primary care. I know a lot of patients don't always appreciate not having a doctor available when there's a doctor that's needed, and we pride ourselves in having that at our clinic.
Yeah, it really, I will tell you guys, for all of those out there listening, we have the most amazing team that we work with together. Our nurse practitioners are top notch. I trust them to make diagnoses in all of my patients, and I'm available to support them whenever we need to clarify a diagnosis. We will often look at an MRI together just to make sure, even if we've looked at it before, just to make sure we're not missing something. And that's the type of care that we offer because we want to make sure that you're getting the most accurate diagnosis possible and the best treatments to target the source of your pain.
We have another question that actually comes up quite frequently in office visits as well. Do you recommend chiropractic treatments?
Well, I will tell you that everybody is different and unique in terms of their spine anatomy and whether or not chiropractic care is appropriate for them. I am not a chiropractor, so I'm not trained in their discipline of assessment and how they go about doing their treatments. But there are certain conditions that we tell patients to hold off on getting chiropractic treatments. For example, very old, very advanced arthritis in the neck, for example, would be one where we tell patients to maybe hold off on that. But it's really on a case-by-case basis. I have many patients who get really good relief from chiropractic care. So it's really making sure as long as the chiropractic care is treating the underlying cause of your pain and it's getting you the results and the functional improvement you need, I don't have any issue with it at all, as long as it's specific, strategic, and safe.
We have another question from Lisa. She's currently seeing an orthopedist for sciatica. Is it hard to get them to refer to your practice?
No, it shouldn't be hard to get them to refer to us. You can just request a referral to ucpmk.com or to our pain clinic, and they should be able to get that referral sent over. We just request that they send whatever records they've been working on with you. If they're working on imaging, for example, very, very important that we get the imaging that they may already have ordered for you. We don't want to duplicate unnecessary tests. We're not going to do that, but we want to have the information that we need to make a good diagnosis. So just request that they make a referral, and then we will be able to get you in and get you seen. Another thing I want to highlight real quick is that targeted pain treatment is not just limited to pain specialists. This is very, very important. Targeted pain treatment is a philosophy on how to assess and treat pain. That is why we do the annual Targeted Pain Treatment Conference here at UT Medical Center, the UT Graduate School of Medicine. It's to really provide that knowledge base and information to those who may not necessarily have been trained in pain management. I don't know, but the latest statistics might say that many medical professionals get less than 12 hours of training, and specifically in pain management, during their entire medical career, their training career. And so in Tennessee, we have core competencies that we require physicians to be and clinicians to be trained in pain management, assessment, and treatment. And we also offer that targeted pain treatment annual CME, continuing medical education course, to provide that knowledge so that you don't have to wait until you get to see me as a pain specialist or Dr. McBride or Audrey or George, but that your clinicians, wherever you are, your primary care clinician, your orthopedic surgeon, has access to the targeted pain treatment principles. That's what that TPT-toolkit.com website, that's what it's for, is to provide that knowledge to other clinicians.
We have a question regarding MRIs. If a patient knows they have degenerative disc disease and they have an MRI from October of 2019, would they need a new MRI before coming to see you?
As long as there has not been any significant changes in your function or your pain, we'll usually work with MRIs that are about within 2 years of age. Now, if you've had a major fall or a car accident or your pain has significantly changed, we'll want to update imaging just because we want to make sure we're working with the most consistent and current imaging. But October of 2019, which with it now being July or June of 2021, is fine, as long as there's not been any major changes to your physical pain presentation. So I want to be respectful of everybody's time. We promised that this would be a 45-minute webinar, and I just want to appreciate and share my appreciation for all of those of you who took your time out to join us live. Please note that this webinar is recorded and it is going to be available on the portal for 30 days. I just appreciate all of you so much. Thank you to the UTK conference team for helping us pull this all together, to the UT Medical Center marketing team to help us get the word out, and also to the Targeted Pain Treatment Outreach and Education Fund that was funded by a generous donation from one of our university institution donors. I just really appreciate the opportunity to share this information with you. I encourage you to check out those resources we listed. I'll try to have them added to the online portal page. And I wish you all good health and hope that you can focus on function and get back to doing the life you love. Bye, everybody.